This project that I'm going to talk about is basically part of my second book project, Captive Contagions, which looks at the history of epidemics and how it has been impressed upon the working class and specifically racialized people, those who are often blamed for epidemics, while also those who happen to heal. So in many ways, I'm trying to articulate in this second project how health and illness in the various degrees that it operates occurs in various degrees of containment. And in a way, like many people that I know, writers, poets, and artists, I have been moved by reading and rereading, and which I have had the privilege to do so in spite of the immense loss of life that many people have experienced from the COVID-19 pandemic, as well as some of the unintentional consequences from that pandemic. And I have reaffirmed my kind of desire to continue to listen and engage in critical research and to work alongside historical sources that find the lives of others that step outside of what we often hear from dominant narratives. And so in a way, my historical inquiry is very much grounded on the work of Black feminists such as Saadia Hartman and her articulation of critical fabulations, as well as the works of Harriet Washington's Medical Apartheid, Dorothy Roberts' work, integral work on killing the Black body. All of those researchers have helped to kind of give me a foundation for asking a certain set of questions. So given that, I want to start off with, what I've been moved by starting off with a picture. So in December 1918, 9 Black nurses arrived at Camps Sherman and Grant in Ohio to treat those suffering from wounds sustained abroad and from the growing virulent influenza pandemic. Many of the soldiers were African-American men who served in World War I, and these nurses, who were pictured, among others, were supposed to aid in relief efforts. In a way, they did. However, they were not afforded the opportunity to do their job at the fullest, insofar that they were initially denied to treat patients in the Red Cross, and more specifically, white patients. This was mostly because of racial apartheid, which was woven into the fabric of American society, which deemed the labor of Black women less worthy in the realm of medicine. On March 1919, the African-American activist Maddie McGee sent a letter to the Crisis, the official NAACP magazine, commenting about the significance of these nurses, citing that, quote, these young women willingly responded to the call when the country needed them, some of them giving valiant service during the flu epidemic. Some of them giving them valiant services and under the American Red Cross. Having been assigned to the military duty, they were faced with every difficulty and are winning small battles for the race. Co-founded by the W.E.B. Du Bois, the Crisis served as one of the oldest and continues to serve as one of the oldest Black-oriented magazines in the world. And the journal attempted to challenge its readers to think about how racism not only plagued American society, but how it also influenced and very much created ill health in the nation. The American Red Cross at the time had previously refused to employ African Americans to serve in hospitals, private nursing facilities, military hospitals, and so forth. So when the 1918 epidemic emerged, which superseded US government's official segregationist policies, there was still a way in which the care for white soldiers by these Black nurses was also impeded. Nevertheless, these Black women who were part of this work, and specifically nursing, were an indispensable part of the medical realm during the pandemic. One thing that Professor Vanessa Nottingham-Gamble notes is that among the challenges that were identified during this 1918 pandemic was, quote, racist theories of Black biological inferiority, racial barriers in medicine, and public health all contributed to the status of Black nurses during the time. The impact of the 1918 influenza pandemic was devastating for all, although suffering was exacerbated based off of gender, class, race, and geographical differences. By the time that the influenza pandemic emerged, there were about 30,000 Black women who were trained as nurses. And their labor can give us some insight as to how the context of how medical services were provided in spite of segregation, how medical services were provided during wartime, and how medical treatments operated during a pandemic. African-American nurses were often on call, but due to the legacies of exclusions in medicine, they were not able to reach their full potential. And so I argue that wartime efforts, military movements, and the lethal influenza virus exacerbated their ability to be able to have equal access to their jobs. I explore how Black women's medical labor, which was limited by racial segregation, can provide insight as to how medical expertise also is exercised during apartheid. Even after the African-American nurses were called upon to Camp Sherman in Ohio and the flu raged, exclusion and discrimination continued after the pandemic. Nevertheless, these medical workers were able to help Black communities and leverage their new professional footholds, however constrained, as part of a broader political struggle to live and heal during a global outbreak. As Maria Isabel Porras Gallo has written in The Spanish Influenza Pandemic of 1918-1919, humans naturally seek to make sense of the world. Thus, the failure of bacteriology to provide a definitive diagnosis of the pandemic diseases, especially considering the weight of the germ theory, might have created a cognitive vacuum that left professionals and laypersons alike searching for answers all the most earnestly. In a sense, the 1918 flu came in 3 waves, roughly between the spring of 1918 and also towards the spring of 1919. And as you can see from this mortality curve shown, there were different waves that impacted the United States as well as in Europe, with Europe specifically having high rates. At the same time, the flu was highly contagious and virulent, which meant that the lack of precautions only accelerated the progression of the disease during high peak waves, specifically in the fall and winter months. In addition to that, the transport of goods and people along various maritime routes facilitated the global dispersal of influenza. So passenger ships that were transporting people across the Atlantic and throughout the Indian Ocean and the Pacific created a myriad of ways in which the disease was able to proliferate. And as often people have been calling it, and I myself don't refer to it as such, during the time, some people in Europe refer to this disease as the Spanish influenza or the Spanish flu. And at an international level, the World War hastened the spread of the virus alongside with various battles and the shipping industry. Part of the reason I hasten myself from using the term Spanish flu is because it dictates that only one ethnic group or one nationality or one space was responsible for the disease, when in fact we know from research, retrospective and otherwise, that it was a global disease, it was a global pandemic. And as Laura Spiney has written in her book on the 1918 flu, the reason that people often call it the Spanish flu is because the Spanish were very accurate about their data and their resources, unlike some other places. Nevertheless, governments across the world were forced to respond quickly to life-threatening influenza, including the US, Canada, New Zealand, South Africa, India, all acknowledging that there was distress to the very medical fabrics of society. And while some preventing techniques such as closure and fumigation of public spaces were adopted, treatments like arsenic, quinine, aspirin were commonly used as well. So there were informative pamphlets and newspapers that circulated throughout the globe, which was important for people to think about how to minimize the disease. So during the 1918 flu, as some of you have read, probably, the wearing of masks was very much encouraged, as well as not spitting in public spaces as well. Beyond that, in places throughout the world, influenza wards started to develop. So these 2 pictures reflect influenza wards the one on the left being in France and the one on right being in Oakland. And during this period, medical staff, to their best of their ability, wore face masks, and they also tried as best as possible to secure an open room, open space, and nets in some cases if applicable. Beyond that, one of the things that's important to note is how many people were impacted by this ailment. So approximately 675,000 people in the United States is believed to have been infected with influenza at the time, and about 50 million, and some people say as high as 100 million worldwide had been impacted by the 1918 pandemic. In retrospective analysis, historians rely heavily on explanatory frameworks to understand how this disease spread, what were the inequalities, and the extent to which people were aware of what was going on. Scientific countermeasures during the time made it so that quarantine, isolation, disinfection, ventilation, and personal hygiene were quickly developed as a way to combat the disease. In addition to that, there are various ways in which public health authorities try to circulate information, as you can see from this particular slide, that try to understand, or in some cases indicate who could be potentially spreading the disease. So sneezers were one of the things. There was also fear about the disease spreading in places like lodges and churches and so forth. And so it was very much part of the popular media, again, on a global scale, to think about this disease. So turning back to where I began, so I want to give you some context to what it meant for African Americans in particular to understand this disease and to combat medicine, and specifically what Harriet Washington calls medical apartheid. So between 1900 and 1920, Black physicians in America sought to understand the factors contributing to poor health of African Americans. They often tried to repudiate the so-called racial inferiority that was being purported by white American physicians and sociologists. So in 1906, W.E.B. Du Bois, who's featured here, published The Health and Physique of the Negro American to document the health status of African Americans and analyze how health is being operated. And his main target was Frederick L. Hoffman, who was a white American statistician who argued that excessive mortality rates in African Americans were due to, quote, not in the conditions of life, but in race, traits, and tendencies. Du Bois refuted him and contended that health disparities in African Americans reflected social conditions, not racial susceptibilities. And Du Bois argued that, quote, improved sanitary conditions, improved education, and better economic opportunities could improve the health conditions of African Americans. So in many ways, the color line that Du Bois talked about in general also entered into the realm of public health. And he, alongside with other African Americans, tried to create medical institutions and organizations that could train a new generation of people. So in 1908, for example, Black women established the Atlanta Neighborhoods Union, a settlement house that's emerged as a focal point for providing people with the National Negro Week. In addition to that, they provided classes in nursing, hygiene, and prenatal care. This structure, again, which was in 1908, provided the foundation so that public health education could be part of the fabric of Black urban life, as well as they sponsored cleanup campaigns and they investigated in local health conditions, lobbying for urban reform. In addition to that, Black people were trained at historically Black colleges and universities in the United States. So the Freedmen Hospital, now Howard University Hospital, which is pictured here in Washington, D.C., alongside with Providence Hospital in Chicago and Lincoln Hospital in New York City, trained Black physicians in healthcare. And this was important to note because even though there was segregation, there was an ability for African Americans to be able to provide care to their communities along the lines of personal hygiene, sanitation, and any kind of ailment that was impacting them. Beyond that, research has also shown, when getting back to the flu, that Black Americans at the time had a lower risk of transmission during the 1918 flu epidemic. Some researchers suggest that African Americans may have likely been less susceptible, mostly because segregation in a way was functioning somewhat as a quarantine. This in many ways has been echoed by this particular researcher, Vanessa Nightingale Gamble. And what that person and others have noted is that pandemics have always disproportionately impacted Black, Indigenous, and Latinx people. But because of the particularity of influenza being so airborne and highly contagious and spreading through war efforts, through transportation, etc., things that in many ways were not necessarily afforded to African Americans at the same rate as white Americans. While some of this information and new research suggests that the low infection rate of Black Americans was due to less exposure, however, they had a higher risk of dying when they did get sick. So this phenomena confounds the prevailing accepted public health understanding that sometimes the poorest parts of the population also suffers the most. At the same time, the scant and inconsistent data on African Americans who contracted influenza has garnered mixed interpretation, and a few records show that many healthcare providers were left behind. What we find and what other researchers have looked at and said that the struggle to save white lives took center stage in the official accounts, with the death of Black Americans was deemed unremarkable, hence the scant data. And hence the skewing of the statistic during this era of explicit and coded racial bias. Here I'm thinking of Ruha Benjamin's work, who's looked at least in the 21st century, the context of which racial coding and data can often be biased. So with limited resources, or in spite of limited resources, Black Americans were forced to establish their own care in segregated hospitals. So turning back to the African-American nurses who had previously been sidelined, especially in the context of providing community care, I want to say their names. Their names are Clara A. Rollins, Sophia A. Hill, Marion H. Brown, Lillian F. Ball, Millward Bolding, and Jeanette Menis, Lillian Spears, Eileen Cole, and C. Jeanette West. They were on call, yet their labor was underutilized. Saying in their names in the fashion that I just did echoes the work of Kimberly Crenshaw, who as a premier intersectionality and critical race theory scholar has used that to really outline how Black women have been the site and targets of the criminal justice system and death. But at the same time, I want to say their names to also acknowledge the work and labor within the medical industry as a source of positive light. Black nurses also played a major role in caring for Black communities stricken despite facing discrimination. Most African Americans ended up being treated in their homes during the influenza pandemic. And throughout the pandemic, the National Herbal League implemented grassroots neighborhood programs to help African Americans in cities during the 1918 pandemic. They trained and hired nurses in places like Columbus, Ohio, and provided free home care to influenza victims. And in some cases, Black American volunteers cleaned up the houses of other Black Americans and assisted as best as they could when people got ill. After the US entered the World War I, the American Red Cross turned away nurses who wanted to volunteer. And part of that had to do with the anti-Black discrimination at play. So many of them, although they were ready and available, were denied. However, people like Frances Reed Elliott, an African-American nurse, was willing to fight and become one of the first Black American women enrolled in the Red Cross nursing service. Sent from rural Tennessee to other parts of the US, she reportedly learned how to drive just so that she can make house calls to patients, both Black and white communities during this period. She went on to fight to make sure that more African Americans could be part of Red Cross efforts. and in many ways helped to establish ways to repudiate the racist dynamics of the medical industry. The globality of the 1918-1919 pandemic, contrasted with segregational medical policies in the context of an ongoing war, very much impacted how we understand a pandemic. The 1918 pandemic was a deadly co-traveler moving freely within US troops, European troops, steam-powered ships across the imperial channels, and its sudden appearance and unexpected virulence paralyzed governments internationally, as well as healthcare system, with most administrations adopting a combination of preventative and symptom relieving measures, some of which were adequate, others not necessarily. And by way of conclusion, I want us to think about how some of the lessons that we can learn from this particular instance, or the ways in which medical apartheid within the medical industry is an issue that we have to reckon with today, is that humans and microbes live in constant communion with each other, whether that relationship is antagonistic or beneficial. However, that liaison can sharply change if we're able to utilize everyone's labor to their full capacity. So in a way, the life cycle of any disease is not just about the number of microbes that are present among us, but it's about the political order of things, the medical advancements, our understanding of contagion, the human hierarchies that we've constructed, the environments that we occupy, who is deemed worthy of having medical knowledge, and so forth. So our engagement with epidemics in the modern era is an extension of the regimes that we live in, the borders that we cross, and who is deemed to be worthy of care. So the historical relationship between the fear of an epidemic, the fear of certain ethnic and racial groups, forces us to think more deeply about epidemiology as a practice, but also the potential regressive politics of racism or xenophobia and how that plays into who is contained and who can be part of healing. So epidemics are a crisis, of course, and it can unfold in many ways, but part of what we need to find is a practice that is adequate so that everyone can find care. Thank you.